to give me the nod. I think the nod has been given that we can make a start on our annual public and members meeting. So thank you so much, everybody. Delighted to have you joining us. I can see we've got about 40 people present at the moment. Hopefully there'll be a few more joining us. But welcome to our showcase for the year. We'll be taking a look back on what we achieved last year, and perhaps tell you a little bit more about us as an organisation as well. Just to make you aware, this is a public meeting, we'll be recording it. So anyone who wasn't able to observe it live can watch it back on playback, and quite a few people took the opportunity to do that last year. So we'd like to do the same thing, and therefore the recording of the meeting has started. Just to properly introduce myself, I'm Krishni Waring and I'm the Trust Chair for NHFT. I'm really pleased to be hosting this event again, and as I said, taking the opportunity to look back on last year, which was, I have to say, another unprecedented year in the NHS. So first job that I have to do is just take you through briefly our agenda, which is the next slide, please. And without going through every point here, but there are some formalities that I need to conclude at the beginning, like the minutes of our meeting, etc., from last year. We're then going to be handing over to a number of colleagues who are going to take you through some presentations and some case studies, which are absolutely critical stories that we want to tell you, and then we'll be holding a question and answer session towards the end, and we'll tell you a bit about how that's going to run shortly. So I believe at the moment we're not quite current in terms of numbers of governors that we need to have present for this meeting. So Richard, do we want to wait for a couple of minutes just to make sure we've got the requisite number?
We can do, Krishni. We aren't too many governors off. The alternative is that we slip this item to later in the agenda. But yes, I think we're only, I think, two members short at the moment.
Okay, so I think we can continue, but it's the approval of the minutes from last year that we need to do whilst we're current for the meeting. So we will come back to that if we need to. But there's a few things that we do want to do in any case beforehand. So before we go towards the minutes, we are going to be using Slido, which is a functionality which allows us to collect some comments and questions from you. And I think it's a really great way of getting some feedback from you. So if you scan the QR code with your phone or type the link into your web browser, you will be able to access the Slido system. Robert, do you want to say any more about Slido? You're probably a bit more expert on this than I am.
No, I think you've introduced it well, Krishni.
Okay.
So yeah, people just scan the QR code, they'll get into the poll.
Lovely. So if you can do that, everybody, just use your camera setting on your phone to scan the QR code, or you can go directly to www.slido.com, and it should take you to the question which is asking you, what are you most looking forward to hearing about this evening? So we will pause a moment to see whether people have got through, and as this is now an active poll, when you comment or respond to that question, I guess the beauty of live, this sort of live technology is I can see several people are in fact typing, and you can see the responses that people are giving. So let's just wait a moment to get more of those up. So there's obviously great enthusiasm to hear about our case studies, which is great. We always love including our case studies because they are really good ways of bringing to life what we do and what our staff do day in, day out. And there's also a real interest in hearing more about NHFT, which so the two big things, or three big things now, because the bigger the lettering, the more people are saying that's what they want to hear about. There's also interest in service stories. We'll just let you carry on, as we can see that there are more people still contributing to that. Okay, I think oh, there's more coming. But it's pretty clear what I think people are interested in hearing about, and that's great because that's exactly what we're planning to present to you. A couple of case studies and things about our services and about NHFT, and the theme of this year's event, which is compassion in partnership, and which hopefully you'll see and feel runs through the event. Now, thank you very much for taking the time to respond to that, and please keep continuing to do that. We're going to be using Slido throughout the session, and as I said, it's a great way of contributing and interacting with what we're saying through the presentations. Now, the minutes of the 2022 annual general meeting have been available on our website. And there is an opportunity for people to provide comments to our minutes, if there are any. If there are no comments, we'll accept the minutes and move on. But as we are not quite quorate on the last count, we're not in a position to do that. But we could probably invite the comments anyway, because there's no reason why we can't invite comments from you relating to those minutes, and we can perhaps come back to their approval later on in the meeting. So if you'd like to look at the minutes, they're available at www.nhft.nhs.uk/APMM. And they are a summary of the discussions and presentations that took place last year. So if we can open the poll on the minutes as well. If there are any comments around the minutes, then we can note those. Otherwise, we will come back to their approval.
I'm not seeing any comments coming up, Christian, in relation to the minutes.
Okay, thank you very much. So we'll note that there weren't any comments, and I'm assuming, Richard, we're still waiting for an additional governor.
Yes, we are expecting governors. They evidently aren't quite yet all logged in. We're one person short, so maybe at the end we can perhaps just revisit the approval as you suggest.
If you would be helpful, Richard, if you can remind me in case I forget in the process of moving on. Thank you very much. If you have any questions, Slido will be open until the end of our annual report and account session, as that indicated, and it will close after the community dentistry case study, which is later on in our agenda, item 7, around 6:35. So that's how long you've got to submit any questions. So without further ado, I want to now welcome our Chief Executive, Angela Hillary. Angela is going to look back over our year, a year of compassion in partnership for 2022-2023. So over to you, Angela.
Thank you, Krishni, and hello everybody and welcome. As Krishni said, my name is Angela Hillary and I'm delighted to be here tonight as NHFT Chief Executive to reflect with you on the year 22-23 and to share some key highlights and all of the aspects that others will also share, but important to say that more information is available in our accounts and within our full report, which I would encourage you to access as well. Slide, please. So, recovering from a pandemic and tackling the challenges currently facing the NHS has not been easy. Apologies, wrong slide. Go back, sorry, I moved it on. Start to the next one, sorry. So, this is, I go back, please, sorry, this missing one. That's it, lovely. Thanks, Robert. So this is our 54321 roadmap, and this is really a signal of what we stand here for in NHFT. And you'll see there our vision to be a leading provider of outstanding compassionate care. And what the 54321 roadmap does is to link that vision with our behaviours, our directorate and teams, and our key enablers of our strategy and our operational plans. And as part of our strategy, DIGBQ, which stands for Develop in Partnership, Innovate, Grow Our Staff, Build Sustainability with quality and safety at the heart and foundation of everything we do, we clearly have a way of working here at NHFT. And I want to move on to the next slide to share with you our key priorities that we had over the last year. As I said before, recovering from a pandemic and working with the challenges of the NHS has truly not been easy for any of our staff. So keeping our focus on the right priorities has meant, really importantly, delivering the compassionate care and safely. And based on our DIGBQ strategy that I've mentioned, we set ourselves 5 priorities: patient-centred care, continuous improvement, innovation, workforce development, partnership working, and I will touch on each of these in turn. So during the past year, our dedicated hard-working staff have provided compassionate and empathetic care to thousands of patients. You will see over 2 million patient contacts there, despite the challenging economic context and the pressures that I've already mentioned that the NHS remains under. But after reviewing the progress overall, it is clear that we can say that our teams have continued to strive and deliver high quality healthcare services to the people of Northamptonshire and beyond. And we remain absolutely committed to furthering enhancing the quality and accessibility of our services in close collaboration with our patients, carers, service users, governors and partners. Now, importantly, to deliver patient-centred care, it's really important that we celebrate compassionate care in action with our teams, and that includes with our volunteers, our staff, patients, and really recognise the achievements that they are delivering across the whole year. It not only validates the care they're providing, but it also serves to remind us what we have to celebrate within the Trust too. So these are some of the highlights in the photos that I just wanted to share. So I'm really pleased to say that we were runners-up in the Trust of the Year category at the prestigious Health Service Journal Awards. Our shortlisting for this award is testament to dedication of all colleagues across the whole organisation, everybody playing a part in delivering the care. Our renamed NHS Northamptonshire Talking Therapy Service also increased the numbers of webinars it offers, including on topics such as menopause and the cost of living crisis, all things that we know are very important to our population. And I'm pleased to say that our NHFT community team for people with learning disabilities held an event for 120 people celebrating what makes living with a learning disability a superpower. That was awesome. And our school nursing team established a new pathway to ensure home educated children have access to the support they need. And our mental health teams won 3 positive practice in mental health awards, one for the Integrated Response Hub, which was really well received across the county, one for the Liaison and Diversion team with Northants Police, and also an Outstanding Leadership Award for Adam Smith personally. Really pleased to see as well that the boroughs are one of our CAMS inpatient units also received a Quality Network accreditation. This is fantastic because it followed in the footsteps of our other facility, the SET, and demonstrated compliance with 100% of the Type 1 standards. We also were able to support BBC Headfest, working with partners to promote mental health support in our community. And really pleased to share with you that we celebrated 5 years of the Recovery College in NHFT. They have helped so many people with their recovery journey across the years. And later this year, we have plans to launch a young person's version of the college too. Now, continuous improvement I've mentioned, but this is really important because learning and improving as an organisation is a constant task. And one of the ways that we do that is to listen to the feedback. And you'll see on the slide some of the reviews, nearly 9,000 of them, contribute towards that listening to feedback. And just to share with you some examples of how we've used feedback, there are too many to go into, but just to give you a flavour, these include the healthcare staff at HMP Bedford. They've introduced telephone reminders to patients for GP appointments to help reduce non-attendance and reduce waiting times caused by missed appointments. Our community mental health teams have significantly increased review numbers by using text messaging to systematically request feedback and now have a very clear understanding of positive and negative themes. And Turn Furlong, where we're delivering our independence bed unit with our colleagues in the local authority, have embraced this patient feedback too, and they're using the system to make sure that we can understand the feedback as we serve the needs with NHFT and our partners in West Northamptonshire Council too. Innovation, so very important. And this links back to the work on the continuous improvement that I've already mentioned. But it's very important that we do this with our partners and continue to look at new ways to innovate across the whole trust. And just to share with you again some examples, of which there are so many. But our mental health crisis pathway is an area where we focused for a number of years. I was really pleased that during a visit in January, the Prime Minister, Rishi Sunak, described our mental health crisis services as trailblazing and exemplary. Also, under the banner of Healthy Young Daventry and with the input of local GPs, we've established the Daventry Teen Clinic. This service was created in collaboration with local young people to ensure it could meet the needs of its users. And a trial is underway with clinics delivered on a regular basis with social prescribers, school nurses, GPs and counselling services on hand to offer help and support. And through our East Midlands Collaborative for CAMS, so Child and Adolescent Mental Health Services, we've worked together with colleagues and providers to join up pathways. We want to make sure that we deliver national ambitions, share our learning from local engagement with young people and their carers, and to develop innovative programmes of service developments to enhance the care for young people across our region. I'm also pleased to say that we've secured a new and innovative contract to deliver integrated healthcare in East of England prisons, working in partnership once again with Central and North West London NHS Foundation Trust. This is a new way of working for us and we're excited about the opportunities it will bring too. Our work on suicide prevention also continues to develop and innovate. And earlier this year, we were part of some prevention and awareness training with Northampton Town Football Club's first team squad. So thank you to them. We're also working, as I've mentioned, with West Northamptonshire Council with our Recovering Independence Bed Unit in Turn Furlong. And this will be a pilot that I'm sure, I'm hopeful, will spread to other units in due course. The NHFT Clinical Systems team has also developed a new patient profile for our clinical record to help clinicians to capture patient equality information. This portal will ensure equality information can be promptly reviewed and updated, as well as accurately recording any adjustments patients may require when accessing healthcare. Now, this links very much to our grow part of our strategy, growing our staff. So workforce development, it's really important we develop and support our workforce. And I'm pleased to say that we did complete a rollout of the Understanding Racism at Work, Speaking Up, Speaking Out, Taking Action programme. And this was for operational managers across the trust. We're also able to increase the resource for our spiritual wellbeing team to offer valuable support to everyone with a spiritual need, whether or not they belong to a faith group. We've introduced our Leadership Matters conferences, so meeting face to face, to provide all colleagues, regardless of their position in the trust, the opportunity to develop and learn together, because we believe everyone is a leader here at NHFT. We also continue to support and lead the Virtual Wellbeing Festival for the system, ensuring that we can spread and equip other colleagues with the tools they need to support their own wellbeing. And I'm really pleased to say that we were ranked as a top 100 employer for our LGBTQ+ people by the Stonewall Workforce Equality Index. And we were also additionally recognised with the Gold Award for exceptional employers who are committed to supporting their LGBTQ+ staff and their patients. Another staff network, our REACH network, which stands for Race, Ethnicity and Cultural Heritage, was shortlisted too as a Midlands Inclusivity and Diversity Awards scheme. In addition, we were shortlisted for leading in equality, diversity and inclusion by the Healthcare People Management Association. And we were also identified by NHS England as being in the top 10% of best performing trusts across the Workforce Disability Equality Standard, the WDES. So developing partnership, our partnership working is central to our strategy. I've spoken under innovation on a number of services we're already working with partners to develop. But over the course of the year, the board also spent time considering how best the trust could contribute to the newly formed Integrated Care Board and the partnership for Northamptonshire with the new Integrated Care Board leadership team and partners. We've considered in that operational financial plans for the system and reflected on the implications of changes in legislation, regulatory regime, and how that can impact on our trust strategy too. We also continue to thrive with our group relationship with Leicestershire Partnership NHS Trusts, and you'll see that one of the areas of focus has been on equality, diversity and inclusion, really important. And our progress this year has included that every member on our Trust Board of Directors has made an anti-racism pledge as part of our ongoing commitment for our Together Against Racism programme with Leicestershire Partnership NHS Trusts. You'll see on the photo there, both boards getting together to understand that work. We've also increased the number of colleagues from diverse backgrounds, including those on higher bands within the trust and across the Foundation Trust Board of Directors too. We have inclusive recruitment ambassadors into our processes for senior roles, and they clearly are making a difference already. And we've established a mental health equality collaborative working with service user representatives to advance equality of access, experience and outcomes in mental health care. So lots to share, and as I've said, it's only a flavour, but I wanted to finish by saying a big thank you. A thank you to everybody who's supported us over this last year. We certainly can't do it without you, we know that. But if I could say thank you to all our colleagues, carers, our patients, our service users, our staff, governors, volunteers, involvees, governors and everybody, partners included. You've all made a difference. We really do recognise that. And a final thanks to our charity partners who've also been absolutely pivotal in helping us to strive for more across the year and help support us to celebrate what we achieved too. Thank you, everybody.
Thank you very much, Angela. A really comprehensive review of various aspects of the trust and things that colleagues have delivered over the course of the year, and much to be proud of, which is really fantastic. And I'd like to add my thanks to everyone who helped to deliver those successes and improvements, which are so important to us. We will shortly be moving on to the first of our case studies, which is really exciting. Perhaps before we do that, as we're corporate at the moment, Richard, I think I'll take the opportunity to just check with colleagues whether anyone's got any further comments to make around the minutes, because as we're corporate, in the absence of those comments, I'm going to take it that the minutes from 2022 AGM and annual public meeting are approved. So I trust everyone's content with that. Thank you. Okay, so I'm going to shortly introduce, I think it's Christine who's going to be leading the presentation for our case study. But before I do, just a reminder that we've got Slido open at the moment for any questions you want to submit on anything that Angela's highlighted to you. They're most welcome, and we'll be looking at them in the background as you're submitting them and trying to line them up so we can answer them at towards the end of the session. So please remember that you can do that. I think it was, I don't have the actual, you can use the QR code that was there, but I think it was www.slido.com. Am I right in saying that?
Yeah, that's correct.
Thank you, Robert. So if you want to go to that, if you were joining late and you're not sure how to access Slido, then please do go to that web address and you'll be able to do that. Okay, I'm really delighted now to introduce the first of our case studies for the evening. This is a case study regarding our crisis mental health services and crisis response unit. And I'm really delighted that tonight Christine Edwards is going to be talking to us about that service, which is a real example of partnership, compassion in partnership. And Christine is the service manager for our crisis response unit. So Christine, if you're comfortable to go, I'll hand over to you. Thank you.
Lovely, thank you. So yes, I'm going to be giving firstly an overview of the crisis response unit that's part of the crisis pathway within NHFT, which went live on the 12th of June this year. Next slide, please. Okay, so the NHS long-term plan requests that all services have access to an improved emergency response for mental health in conjunction with existing emergency provision. So the crisis response unit was developed to provide a more local response, supporting service users closer to their home. A key objective for the service is to provide a more timely response to assessment of mental health needs. Also preventing the use of accident and emergency departments for purely mental health presentations. The service intends to respond to community emergencies within 1 hour rather than the current 4-hour response, and building on existing services and working in collaboration within those services. Next slide, please. So we have a referral pathway in the East Midlands Ambulance Service will need to have assessed any physical health need. Clearly, they need to do that first before we can respond. So ensuring there is no requirement for a person to attend accident emergency, because if there is, that's where they need to be. The primary reason needs to be mental health related. So East Midlands Ambulance Service will make a call after they've checked physical health and complete the referral to the crisis response unit, who will then be checking clinical records to get an idea of any current involvement or historical contact within services. So once they've accepted the referral, the crisis response unit, as I've said, will make that aim to respond within the hour. They'll be looking at completing an assessment, intervention, safety planning, and onward referral where appropriate. Working in a trauma-informed approach, so using the ROOTS model, which is a reflective framework mapping an implementation journey. So we're ensuring that we're offering that as a service. Next slide, please. So here we have a picture of some of the team and the crisis response vehicle. So we looked carefully at the skill mix with the crisis response unit so that we have clinically experienced autonomous practitioners who can assess and prescribe for mental health care needs. Peer support workers and carer peer support workers make up part of the team. So the aim is we're supporting the service user, but also carer, friends and families during the acute mental health crisis. As I said, we're working alongside the teams, so our urgent care and assessment team, the crisis pathway, as well as the wider NHFT services. And we're looking at de-escalating crisis situation, making an assessment, onward planning and response. So we have 18 individuals from a variety of professional backgrounds. So we've got nurses, social workers, occupational therapists, support workers, and like I said, the peer support workers and carer peer support workers. When we receive a referral and we respond in our beautiful vehicle, we use a minimum of 3 staff that will be deployed, a minimum of a band 7 clinician, the band 4 support worker, and where possible, a peer support worker or carer peer support worker. And our preference is to support the individual within their home environment, but if they prefer a place of safety of their choice. And when I go through the case studies, we also use the van. The van's equipped as a sensory van, so it's got sensory lighting. It's very comfortable, and we've got sensory equipment that we can use to aid with any people that might be very anxious at that point. Next slide, please. Okay, so this slide shows our engagement so far as of the 23rd of the 8th, 2023. So we went live on the 12th of June. Since that time, we've received 159 referrals from East Midlands Ambulance Service, deployed the crisis response unit to support 140 individuals, avoided 98 mental health inpatient admissions, supported 119 individuals within 1 hour of that referral being received, avoided 103 accident and emergency conveyances, and helped 48 individuals by signposting them onto a more appropriate service for support. And prior to starting with the crisis response unit, we had a 2-week induction with the team so that we were able to look at the skills, explain the aims of the service, and we looked at that trauma-informed response, brought in suicide awareness, as well as leads from other NHFT teams, so we could look at how we work in partnership with each other. Next slide, please. Okay, so on to our case studies. So we have case study 1. So this first case is a 20-year-old male. East Midlands Ambulance Service were called out to this service user because he was experiencing suicidal thoughts. So the ambulance attended, they ruled out any physical health need, and there was no requirement for that conveyance to the accident and emergency department. The service user disclosed that he was experiencing thoughts to go and crash his car. He became scared by these thoughts and he called the ambulance himself. East Midlands Ambulance Service referred to the crisis response unit, received the referral through, and they responded within the hour time frame. So they went to the service user's home address. What they found, though, he struggled to articulate within the home environment. He was clearly very anxious, and it took a little bit of engagement with the team. The team asked the service user if he would be more comfortable talking outside of the home, and they used the response vehicle to complete the assessment. And as I said, the vehicle's equipped with that sensory lighting and had sensory equipment. So with that, the service user felt more relaxed and they were able to complete the assessment. They established the service user was under the community mental health team, as well as our autism pathway. They listened, validated, and were able to establish the triggers for the current crisis. The service user was finding a change in his current work environment really difficult. With that, he was experiencing social isolation and a lack of structure during his day. The work change was the biggest catalyst, and the service user felt unable to discuss this openly with his employee around his additional needs. The team were able to explore collaboratively with the service user on accessing community support. They linked him in with the Frank Bruno Association, the Integrated Response Hub that he could use any point, and Mind groups. They linked in with the community mental health team, the ADHD and autism pathway, to look at additional support needs that could be provided longer term. The service user felt more positive following this assessment and actually quite empowered to then go and talk to his employees around what support he could access at work. So they developed a support plan that he could take away, and with that he felt more confident to talk around what his needs were and how they could make adaptations at work. So the second case study is a 51-year-old male, again, experiencing suicidal thoughts. His wife had called the ambulance due to concerns around his presentation. The ambulance service attended, and again, ruling out any physical need and no requirement for the service user to attend the A&E department. Therefore, the referral went into the crisis response unit. Again, they responded within that hour time frame. Present at the home address was the service user himself, the wife, son, as well as the ambulance crew. 3 of the team attended, which included the carer peer support worker, who spent time supporting wife and son, whilst our clinical team were supporting the assessment. The service user is a veteran who more recently had been experiencing post-traumatic stress disorder, with that flashbacks and the inability to switch off from a negative way of thinking. There were a number of financial stresses, and the family were at risk of losing their home. The service user, due to this presentation, was unable to gain employment and felt he couldn't support his family. The wife was clearly struggling and experiencing significant carer strain. She was worried to leave her husband due to the fear that he would harm himself. The team were able to support the family, completing an assessment with the service user and identifying that need for more support. A discussion took place around the admission to one of our crisis houses for a period of support to take place outside the family home. The service user was able to identify aims and goals for the admission, focusing on the social situation, but also the need for psychological interventions. The carer peer support worker in this case completed follow-up with the family, in particularly the wife, enabling her to get access to support and linking her into carer support groups, ensuring that she had that support for herself. The service user had a 7-day stay at the crisis house where he was able to look at debt management and supported with financial support agencies. The staff within the crisis house supported him to develop skills and coping strategies, and he self-referred to talking therapies and veteran support. After a period of recovery, service user is no longer under mental health services. They've managed to maintain the family home, and he's actually at the point where he feels able to return to employment. We gained feedback from both the service user and the wife, and they both reported that the crisis response unit made a positive impact and supported right at the time where they needed it the most. Thank you.
Christine, thank you so much. I think that really showcased the value of the service that you and colleagues and everyone involved in it have developed together with our service users. What poignant and powerful experiences you've described, and most importantly, more positive outcomes, I think, for our patients and service users. So thank you on behalf of the board and the Council of Governors for the fantastic work that you've done to get this off the ground. It's something we're really proud of, and I really look forward to hearing more about it, the successes we've achieved with it in the years to come, because obviously this is a huge new development. So thank you, Christine.
Thank you.
I think, Christine, you're going to stay with us, aren't you, for the rest of the event, because we may have some questions about the service and we may need your help in answering them. And just to take that opportunity to say, if you do have any questions that have been prompted by the presentation, Slido is open for you to record any questions. And just to remind you, it's www.slido.com. So you go to that and then you just enter the event code, which is hashtag APMM 2023, and you can record any comments or questions that you wish. Obviously, I will say that as this is a public forum, it wouldn't be appropriate for any sort of personal or confidential comments relating to your own care if you happen to be a service user. So I would encourage you not to use this channel for that, but obviously to contact using a more appropriate channel. But certainly any questions appropriate for public discussion, you are more than welcome to add in, and we will do our best to answer as many of them as we can. So without further ado, I'm now really delighted to move us on to our next section, which is an opportunity to review what our Council of Governors has achieved in 22-23. We're going to watch a presentation from our council, and just a reminder for colleagues who perhaps are not familiar with the role of a Council of Governors, it's a really important part of our governance arrangements as an organisation, and helps us both ensure we're well governed by holding the board to account, but also ensuring that we meet the needs of the communities that we are serving within predominantly Northamptonshire. So the governors can take the opportunity to gather the views of trust members, of which I'm sure I'm going to be corrected on this, but I think at the last count it was something around 10,000, but Richard will perhaps give a thumbs up or not, as the case may be. It's really important that we have that, the governors acting as a conduit really for the views of our members, but also views of the general public. So we're going to play the video, which features a number of our governors, and I'll ask Robert or another colleague who's got the control of that to press the button.
Welcome to this year's annual public and members meeting. My name is Richard Amponsa, and I'm interim lead governor for NHFT and also a staff governor for registered nurses. NHFT governors are a committed and dedicated group of people with different life experiences. Together, we bring a diverse range of views from our stakeholders and communities right into the heart of our trust. The Council of Governors have several specific statutory duties, although these duties do not include the day-to-day management and running of the trust. The Council holds the non-executive directors individually and collectively to account for the performance of the Board of Directors and the Trust overall, as well as offering views on the Trust's plans and priorities. Our governors are an important bridge between our Trust and the people we serve. They also play a key role in representing our members' interests, as well as the interests of the wider public. During this video, you'll hear from some of the members of the Council of Governors about the work undertaken by the Council in 2022-23, as well as future plans.
Hello, I'm Joanne Dalrymple-Smith, a Staff Governor. I became a Staff Governor as I'm passionate about ensuring that both the patient and staff's voices are heard. I have a deep understanding of the issues and pressures faced by both patients and staff, and I care deeply about how pathways work for patients. In my Staff Governor role, I have been able to work in partnership with my fellow governors to seek assurance from the non-executive directors about how a number of different services are currently delivered. I would like to talk to you about membership, being representative, and engagement. Firstly, with regards to membership, governor elections were held during the fourth quarter of the last financial year, which led to the appointment of 9 new governors, representing public and patient and carer constituencies. These new governors joined the Council in April 2023. A new membership database was successfully established this year to improve the way in which we engage with our members across NHFT. This includes being able to contact members directly from the database. Moving on to being representative, a socio-economic report of public membership was undertaken in April 2022, and this helped shape the membership priorities in both 2022 and 2023, and moving forward into the next year of 2023-2024. The Council of Governors also reviewed its membership constituencies and the governors' seats during last year to ensure it continued to be representative of the people it serves. You can find more information about this in the Governor Elections section of the NHFT website. And finally, on engagement, a new Council of Governors membership engagement and representational group was established in 2022-2023. We also continue to roll out a programme of interactive events and webinars for members throughout the year where NHFT experts, leaders, clinicians and partners shared information, expertise and practical guidance on topics our members have told us are important to them. Relevant communications of interest are collated and sent to governors in a single weekly email bulletin, which is very helpful. Our governors also use the members bulletin to engage with members.
Hello, I'm Simon Davey, Public Governor for Kettering and Corby. I was motivated to become a governor due to being a recent user of the services provided and surprised that these services are not as well known in the greater community. I was elected in the role in April this year, and my first 4 months has been in education, learning about the great services the NHFT delivers. Before I joined the NHFT, I was not aware of these services, and I believe that these services should be celebrated. Each person requires the best service and care available to them. My aim as governor is to ensure that the services are shared with the community and the community can share their feedback to ensure that the right services are being delivered to an outstanding level. The Council has agreed to 5 priority areas to focus on for 2023-2024, including improved representation and engagement with children and young people. We are holding specific member webinars on careers in the NHS and children and young people participation, as well as gathering feedback through a survey asking young people which are their key priorities. Looking to improve representation and engagement related to equality, diversity and inclusion. Using the member webinars to reach those who may need advice and support accessing services or who may wish to simply get involved with the Trust. To improve the diversity of the membership to truly represent the communities of Northamptonshire, a survey is planned in the new year to help identify what is important and key priorities for underrepresented communities. And finally, build infrastructure to support retention and engagement of current membership and the wider public. Feedback we have received tells us we need to strengthen our digital offer to reach more people, to be more sustainable and to enable a two-way dialogue. We are therefore building digital engagement into our regular members' bulletins, for example, including access to online video content and surveys. These are exciting times for the NHFT and one that I will be looking forward to as your representative.
I'm Councillor Matthew Golby and I'm a partner governor appointed by West Northamptonshire Council through my role as the Cabinet Member for Adult Social Care and Public Health. And I think it's really important that different component parts and organisations from within our system come together to help and support each other. And for me personally, I get a great understanding of lots of the challenges that NHFT are going through, as well as those at West Northamptonshire Council. One of the key roles of governors is to contribute to the trust plans and strategies, which feeds into the wider system plans. This is an annual item at the Council of Governors meeting, and the Code of Governance states that the Board of Directors should in a timely manner take account of the views of the Council of Governors on the forward plan. Governors from NHFT joined together with our counterparts at KGH to again hold joint sessions across 22 and 23 on the Integrated Care System, or the ICS. Through these events, we sought to understand the Integrated Care Across Northamptonshire work, or ICAN, the role of the People Advisory Board, the role of partner members of the Integrated Care Board, and the Integrated Care Partnership Strategy. Working on these sessions across the two NHS Foundation trusts has enabled governors to develop mutual trust and understanding together with enhanced effective collaboration and partnership working. And a fantastic example of this partnership working is the Recovering Independence Bed Unit at Turn Furlong in Northampton, where NHFT staff and West Northamptonshire Council staff work really closely together to give patients who have just been discharged from hospital the very best chance of living as independently as possible when they return home.
Hello, I'm Carol Phillips and I'm Chair of the Governor's Nomination and Remuneration Committee, otherwise known as Non-Rem. This committee acts on behalf of the Council of Governors and plays an important role in leading the processes for the appointment, removal or reappointment of the Chair and Non-Exec Directors, or NEDs. This committee also sets the terms and conditions, including pay, for the Chair and the NEDs, and manages the annual Chair and NED appraisal process. In 2022-23, we've been quite busy. We have reappointed a Non-Exec Director for a second term, appointed a new Deputy Chair, extended the term of the Trust Chair for a further year, and managed successfully the Chair and NED appraisal process. We have also recruited a new NED and 2 associate NEDs using a rigorous selection process involving both the committee members and other governors. The associate NED appointments were a new departure for NHFT. These are individuals who have responsibility of holding the executives to account, just as NEDs do, but they do not have voting rights on the board of directors. The new appointments have all come from diverse experiences, one from primary care, one with experience of the voluntary sector, and one with experience of local government. They have settled into the role very well, and each one has brought their own previous experiences to the working of the board and to the Council of Governors. I think this demonstrates how important the responsibility of Non-Rem is in the recruitment of NEDs and the governance of the Trust overall. Thank you for listening.
It has been a busy year for the NHFT Council of Governors, in which we've sought to build on the work undertaken in previous years. In line with our trust values, we have endeavoured to demonstrate compassion in the way that we engage with all stakeholders. Please visit the Trust website to find out more about the work of the Council, to find recordings of Council meetings and member events. You can also find out about becoming a governor, and there'll be opportunities in early 2024 to stand as a governor as well as to vote. I would like to take this opportunity to say a big thank you to the Council of Governors for all the work that they do to support the Trust and to provide value for our service users and carers, Trust employees, and the wider communities we serve. Thank you very much.
Thank you. What an excellent set of videos, really explaining for everybody who's watching how the governors work and the fantastic range of areas in which they contributed to the organisation and to the communities we serve. A really great testimonies, I think, from a range of governors showing the breadth of the work they do. So thank you to all the governors involved in that, and thank you to the whole Council of Governors for their contribution to the achievements of the Trust over the course of the last year. I'm really pleased now to move us on to our annual report and accounts and our quality account for 22-23. And the first person I'd like to introduce you to lead us through this is our Executive Director of Finance, Richard Wheeler. Over to you, Richard.
Thanks, Krishni. Good evening, everyone else. Good evening, everyone. My name is Richard Wheeler. I'm the Director of Finance for the Trust. So I'm just going to take you through some of the headlines for our accounts for the year 22-23. If I can have the next slide, please. Thank you. So our full annual report and accounts are available on the Trust website. What I've captured here is just some of the highlights for the year. Safety of patients is our top priority. We're very proud of our culture of compassion and our unwavering commitment to care. There was significant risk in our planned budget for 22-23 and our support to provide overall system benefits. We did incur a deficit of 9 million in a very challenging year, in contrast, as you can see on the slide, to surpluses that we generated previously. We have continued to invest in the organisation, spending over £11 million in new facilities, equipment, and our revenue also grew to 325 million. We have been impacted by many of the factors that affected all sectors, such as inflation, increasing demand for our services, and that's across a range of services, mental health, community and children's services. NHFT did, however, remain as a Segment 1 organisation, which means NHS England assessed that we had no specific support needs. And at the same time, we have increased our collaboration in support of service provision to our patients, carers and the environment that our staff deliver services in. If I could have the next slide, please. Thank you. I borrowed some information here from some infographics from NHS England, which shows some of the national position on healthcare spending in terms of the context of total government and health spending by activity. And I wanted to give you a bit of a flavour of where NHS spending fitted within that overall government position. These are national figures, and in comparison, when we look specifically at Northamptonshire, the budget for our Integrated Care Board, who are the commissioners for a large range of our services, is around 1.5 billion. And as I said previously, the total income for the Trust last year was around about 325 million pounds. So looking forward, the NHS turned 75 in the summer, and there are a number of key aspects. I've focused only on two in this section. Firstly, innovation. That's been a cornerstone of the NHS. And I'm pleased to say we've provided a small innovation fund to support development of ideas and improvements across the Trust. And secondly, the first comprehensive workforce plan for the NHS was published in the summer. Actions fall into three clear priority areas: training, retaining and reforming. That's to support flexibility, introduce new skills, alongside creating a compassionate and inclusive culture. Please access the Trust Annual Report and accounts on the website, and that will give you much more comprehensive information on our performance and financial achievements over the year. Thank you very much. I'm going to pass over now to Grant Patterson, who's our external audit lead, if that's okay, Krishna. Thank you.
Thank you, Richard. Yes. Good evening, everybody. My name's Grant Patterson, and I am the External Audit Engagement Lead for the Trust, and I'm a director with Grant Thornton in terms of the external auditors. I'm going to be joined this evening by colleague Jeanette Beale, who led on our value for money work. Before I do that, I'll briefly take you through the role of the external auditor. Can I have the next slide, please? So for those of you who are actually on the attended the meeting last year, just a reminder, and also for those who are new, what is the role of external audit in public sector? It is to provide independent assurance to the Council of Governors, and through that, that's giving an opinion on the Trust's annual accounts that are included in the annual report, and give a view that they present a true and fair view of the assets and liabilities as at the end of March, and the overall financial performance in the year. Being a public sector auditor, we also have additional responsibilities, and that includes providing a commentary on the Trust arrangements for the use of resources, or more commonly known as a value for money conclusion. We also have specific response or reporting powers. If we identify any issues of significant concern, we can make referrals to NHS England, or we can do reports in the public interest. Have the next slide, please.
So how do we go about performing that role? Well, it's an annual audit cycle effectively. So normally from September to December, we're beginning to re-engage with the trust, understand what changes in the year. We produce progress reports, and then moving on the first quarter in terms of January to March, we were doing our detailed audit planning. And if there's any interim findings coming out of that, we're reporting back on that. And then I suppose a lot about the focus of our work is in the period April till the end of June. And that's when we'll actually be doing the detailed work on auditing the financial statements of the trust, and then reporting those of what we call audit findings, or an ISA 260 report for those who are interested in the names of auditing standards. And then towards the end of that month, that's when we also bring in the work that Jeanette will talk you through in a moment into the value for money. And then there's a statutory thing where we have to issue an audit certificate concluding the audit for that year. And as that shows there, we issued that on the 30th of June this year. Can I have the next slide, please? So just who does consider our work for public sector auditors? The primary, I suppose, body that we talk to at the trust is the audit committee. That considers our audit plans and our reports, also considers our performance, and also we confirm our independence to that, and it checks on our independence. We also report to the board, because the board ultimately approves the audited accounts and the annual report, and would actually look to act on any audit recommendations. And there is consideration if we do any non-audit work for the trust, and we haven't done any this year, then it has to consider that. As I said, also in terms of the Council of Governors, they do appoint and remove formally ourselves as external auditors. We also communicate any significant issues to them, and again, they're part of that non-audit work approval. And then finally, I suppose outside of the trust, NHS England and the National Audit Office, they both receive a copy of our audit findings reports. They both receive a copy of our report on value for money arrangements. And if we have to make any of those specific referrals and public interest reports, then they go directly to NHS England as well, and ultimately up to ministers. That's the next slide, please. So what do we actually find this year? Just to remind, in terms of it's our second year for Grant Thornton as your external auditors. There wasn't any significant change to our audit approach this year. Our focusing for those interested more in intricacy of audit is on accounting estimates and judgments, i.e. valuation of land and buildings, what we call revenue income recognition, and any provisions alongside what we call management override of controls. We have no issue to report on any of those significant risk areas. We were comfortable with that the accounts presented fairly, and no issues to report. If you're on the meeting last year, we did discuss some misstatements from last year in terms of accruals and provisions. The majority of those have now been utilised or released, so those matters are no longer of concern for us, and no material misstatements were noted. We have to report small adjustments, and there was one adjusted misstatement of £369,000, and that was in respect of the historic information to support one provision carried forward. But that needs to be put in the context, as Richard was saying, is expenditure for the year was around about £330 million, so it's not going to mislead anyone reading the accounts. We did make a few recommendations around payroll processes and improvements to the fixed asset register, but we didn't have anything there were no issues that required special reporting powers from ourselves. And just to be clear, we issued an unqualified opinion on the financial statements on the 23rd of June, which was a week ahead of the NHS account submission deadline. And following completion of our value for money work, we issued the audit certificate on the 30th of June, and that enabled the trust annual report and accounts to go into the first tranche of Parliament for approval. Can we have the next slide, please? So that's the main statements of accounts audits. I was now going to pass over to Jeanette Bill, who's a value for money specialist, and she'll take you through some of the main issues of value for money. I think if you picked up from Richard's presentation, the trust this year, its expenditure was greater than its income, and therefore that was why when Jeanette takes you through that, one of our focus areas was around financial sustainability. But I'll now hand over to Jeanette to take you through the next couple of slides.
Thank you, Grant. I assume everybody can hear me. Yeah, people are nodding, so always good to check. So good evening, everyone. I'm Jeanette Beale. I'm a value for money specialist, and I undertook the work that we at the Trust. I think it's important to start with that with the value for money arrangements, we didn't identify any significant weaknesses in arrangements, which is a very positive thing. As Grant said, our main focus was on financial sustainability, and we looked at that in detail because the plan was originally for a break-even position, and the Trust, unfortunately, at the end of the financial year was in a deficit. As we say, that so looking at financial sustainability, the Trust ended with an overspend as a deficit of 9.3 million, having originally planned with the Northamptonshire healthcare system to deliver a surplus. It became evident partway through the year that the original plan for a break-even wasn't possible, and as a result of that, discussions began, and the a revised financial position was negotiated with NHS England, which was for a revised overall deficit overall system-wide deficit of 35 million and a deficit for the Trust of 9.3 million. Now, part of the reason why it wasn't possible to achieve the original plan was it was based on a number of assumptions and savings that would be delivered. It was assuming that, such as, for example, COVID and the impact of COVID wouldn't be as great. It was assuming, inflation wasn't going to be at the level it was going to be, or I became. So as a result, a new position was negotiated, and which was still challenging and required the Trust to deliver in the region of £22 million in savings and efficiencies. But on the basis of that, on the basis of the how the Trust was able to achieve this, we concluded that there was no significant weaknesses in arrangements for the financial year 23-24. Going forward, I think what is a key element, so again for 23-24, the system has again agreed a break-even position, with the Trust agreeing a break-even position. This will be a significant challenge, and I think it's something that we as your auditors will be watching brief, and I'm sure officers as well will be working very hard to deliver that. Again, it won't be an easy thing to achieve, and it requires savings and efficiencies to the value of 15.62 million. Although there will be some support from the system of 8 million as well. Sorry, strange thing appeared on my screen. In addition to that, I'd say the focus on financial sustainability, we also identified 6 improvement recommendations, and it's important to note that improvement recommendations are good to have, moving towards notable practice. They're not areas where we consider there to be significant weaknesses in arrangements, as I said. So if you could just move on to the next slide, please. Oh, I think we jumped, if we could go back one. Thank you. So again, the area that we focus our work, we look at 3 areas: financial sustainability, governance, and improving economy and efficiency and effectiveness. So the recommendations just drop out of those 3 areas of work. So first of all, in financial sustainability, we picked up that planning could be improved, and reports to Trust Board could be more clearly set out risks and mitigation. So again, it's just providing additional support to those charged with governance of the information and the Trust Board that they receive. We also, a key thing to ensuring sustainability was about bringing forward the identification and development of work streams in the trust value programme. In other words, bringing forward those savings. If you need to deliver savings, if you can, the sooner you can look at them and the sooner you can identify, the trust can identify them, the better chance of delivering them and also delivering a full year effect for them. It just just stands to reason you bring it sooner, it makes it easier for the year that you're looking at in question. We suggested that the trust should review its code of conduct for directors, and that just again ensuring that they're in line with good practice and up with the latest things that hadn't been updated, I think, since 2013. In respect of under improving economy efficiency and effectiveness, we picked up that it was quite looking at an indicator and look at early intervention for individuals experience a first episode of psychosis, that this percentage that were looked at within 2 weeks, which is within the guidelines, was low. So again, look at that to investigate how that can be improved and the cause and effect of why those rates are currently low. We suggested that there should be reintroduce regular reporting to the audit committee on the number and value of contract waivers. Previously had been quarterly reporting last year in 21-22, and it had gone to annual, although that was in line with your standard financial instructions. Again, notable good practice, which is suggests that if you're looking at it more regularly, you can act on it and make changes as a result. And lastly, we picked up the review arrangements in respect of competitive tendering on contracts. Again, if you're looking at when contracts are coming up, it's about looking how you might look at those contracts coming up to ensure that they're meeting within the time frame so that you can act upon and re-tender contracts before they're coming up for renewal. That's next slide, please.
I think I'm going to pick just the final slide up from Jeanette here in terms of 23-24. I mean, I think just going back to just put it in context in terms of the trust overspend for last year, they had to put in the context of the new system working and the challenges of the NHS as a whole, and that's why we were satisfied that actually the response of the trust was appropriate and reasonable, and therefore there were no weaknesses for us to report. We will be building on our understanding of the trust for 23 from 22, 23 and 2024, and also there'll be areas of improvement. We're working with management around looking to make the audit more effective and efficient, and our overall process is due to start early in the new year. I'd just like to say thank you to both all the governors and the management and the wider team for their support and cooperation throughout the audit process. I think that's the final slide from us.
Thank you very much, Grant, and indeed, Jeanette. Really important for you all to hear from our external auditors in providing that view of the trust accounts and the value for money opinion. And thank you also, Richard, for presenting an overview of our financial performance. Very much appreciated. If you have any final questions, I think there might still be a brief opportunity to add any questions to Slido, unless Richard indicates we've closed it. I think we've got a few more minutes, but we will be closing it soon. So just to remind you, if you want to, I know we've had some questions through, but if you want to add anything else, or any comments or questions, then it's www.slido.com. Event code #APMM2023. So your last few minutes to submit any final questions. I'm delighted now to move us on to our final case study before the question and answer session. And this is another case study on compassion in partnership. And this one features Jill Howie, consultant and acting clinical lead for special care dentistry. So over to you, Jill.
Thanks very much, Krishni. So for those of you who don't know me, my name is Jill Howie and I'm a consultant in special care dentistry and currently acting clinical lead for the specialist dental services. Next slide, please. And I'll just let you take that slide in for a moment and then next slide again, please. So it's such a pleasure to be able to talk to you about special care dentistry in NHFT, particularly because it fits so well with the theme of compassion and partnership this evening. Now, special care is one of 13 dental specialties recognised in the UK, and it's all about ensuring that patients who would otherwise find it almost impossible to access or accept dental treatment can receive essential care. Now, these are the main groups of patients that we help to care for, but categorising tends not to be helpful, and most patients in reality have a combination of these elements to consider. Now, the clinical dental care that we deliver ranges from removal of teeth and simple oral surgery through to a variety of restorative procedures like fillings, dentures and gum treatment. Next slide. Almost every episode of care relies on partnership working, and this is a key part of our approach in making sure that patients receive the highest standards of care. So to give you some examples, I'd like to tell you about a few of the patients that we've looked after in the past year. Next slide, please. We work with almost all the medical specialties, but a more regular collaboration with the congenital cardiology service began when we saw Danny. Now, Danny has Down syndrome and he also has a condition called Eisenmenger's. And this is a collection of symptoms that develop from irregular blood flow from the heart to the lungs. And in this case, it was caused by a hole in his heart. Now, dental care is critical for patients like Danny because bacteria in the mouth can lead to infections of the heart, and they're much more dangerous for people who already have heart conditions. But it can be challenging to plan any surgery because we have to minimise stress to reduce the pressure on the heart, and we often use sedation to help with that. Now, Danny came to us without any pain, but he had struggled to find a dentist to help look after his mouth. And so nobody had explained the link between good oral health and improved heart health. And as a result, he had gum disease and a number of loose teeth. Now, he had been through so many operations and spent such a lot of time in hospitals that the priority for him was to improve his dental cleaning, stabilise his gum disease and reduce the bacteria that would be able to impact on his heart. It was also important, though, that we had a plan in place so that if he did get infection around any of these loose teeth, we could remove the teeth quickly and safely. Now, Danny needed some support to make those decisions. And in special care, we spend a lot of time hosting best interest meetings, which many of you will be familiar with. But these are meetings that are advised under the Mental Capacity Act when patients can't make a decision on their own. And in this case, we had Danny, his mum, his brother, the congenital cardiology consultant, an anaesthetic consultant, and me to contribute to this decision. And importantly, make sure it was the right one for Danny specifically. Now, this level of reassurance is of such benefit to the families of patients like Danny, and his mum's comments were that she wished she had found us years ago. Next slide, please. We also work hard to develop partnerships with other surgical specialties, particularly in the acute trusts. And the main reason for this is so that we can make the most of every patient encounter and avoid repeated general anaesthetics to the benefit of the patient, but also the organisations. And this plan came together nicely for Harriet. So Harriet came to see me for a second opinion because her family were concerned that she was losing weight and she was distressed. Now, lots of our patients can't tell us verbally that they are suffering with toothache, and so we have to do some detective work to allow them to communicate with us in a different way. And this is why we asked our family to record a pain diary. And this is a basic tool that we've developed to look at things like sleeping patterns, changes in behaviour, eating habits, response to certain foods, and response to oral care. And it gives us remarkable insight into whether someone has toothache. Now, patients like Harriet aren't usually able to manage an examination or treatment while they're awake, and we want to be sure that we're giving sedation or an anaesthetic for a good reason. And for Harriet, that was particularly important because there were additional risks that meant that general anaesthetic was the only viable option, but one that carried a great deal of risk. We realised on taking her history that she had significant reflux and was also due for an investigation with an endoscopy, so a camera through her mouth and into her stomach at Northampton General. We were convinced that Harriet would benefit from dental work, so we liaised with the gastroenterology team to secure a place in their theatre, and we investigated and managed Harriet's medical problems under one general anaesthetic. One of the great things about my job is that I get to see a lot of other surgeons at work. Now, you can imagine my surprise when the endoscope was placed, and after a great view of the inside of her tummy, I saw two huge googly eyes. Harriet had swallowed a rubber centipede when her family's back was turned, and the toy, that was more than 15 centimetres, was removed on that day. Now, Harriet's family have told us recently that not only has the dentistry had a really positive impact on her quality of life, but all small chewy toys in the house have now been permanently removed. Next slide, please. Sometimes the main challenges that our patients face aren't related to the surgery itself, and this was the case for Helen. So Helen has a learning disability and bipolar disorder, but when she's asked to do something that frightens her, like leaving the house or having dental work done, she can demonstrate aggressive behaviour. Now, she had terrible pain, and we knew that she had lots of broken and decayed teeth. Sedation wasn't suitable for her, and we planned to provide her care under general anaesthetic, but this time we were able to do it at our own special care list at Kettering General Hospital. And these lists are a joy because we can make so many reasonable adjustments. And after a great deal of planning, we knew exactly how we could help Helen, but we needed to get her to the hospital first. Now, there is nobody that Matt and his team at Elite Transport can't get to a clinic or a hospital. They visit the patient at home on at least one occasion for risk assessment and acclimatisation. They often wear plain clothes, they've got access to ambulances, soft cell transport vehicles and cars, and most importantly, they have a paramedic as part of that experienced team. This meant that Helen was given the sedation and the physical support she needed to get to the hospital safely. And we arranged some blood tests and an ECG in addition to her dental work. And then the Elite team were able to get her back home and into her own bed before she fully recovered. Now, Helen's care staff gave us gold stars all round, and I think that's a real testament to a great partnership formed with Elite Transport this year. Next slide, please. So not all of our partnership working is clinical. People who face substantial barriers in accessing dental care are those experiencing homelessness, and a really exciting piece of work in the past year has been with our colleagues in dental public health. So we were approached by a group who were undertaking a co-production project who requested our input because we had recently established a drop-in clinic for these patients at our St James site. But there was more work to do in promoting the service and in encouraging patients to attend. And we were successful in obtaining some additional funding through this work that allows us to develop partnerships with local charities like the Hope Centre. And this funding is what made the difference for Graham. So Graham's previous dental experiences had left him so afraid of the dentist that he had self-extracted a number of teeth over the years. And it was the non-dental chit-chat with our team at a promotion session at the Hope Centre a couple of months previously that had given him the confidence to come and see us when he did have toothache again. He coped brilliantly with the familiar faces, and with a bit of TLC, we were able to remove his infected and painful tooth. And the team's specialist experience allows us to consider any additional medical risk and quickly assess the benefit of the clinical treatment. Next slide, please. We're especially grateful for some of the partnerships that are only possible because we are part of a trust like NHFT. And I've saved this final example because being involved in Natalie's care was a true privilege, and it really was the epitome of multidisciplinary team management. I had a phone call from the community nurse for people with learning disabilities to request a domiciliary or home visit for this patient. So she was non-verbal with severe learning disabilities, but Natalie wasn't eating or drinking, and she'd been engaging in self-harming behaviours that had resulted in open wounds and almost complete absence of her earlobes, with wounds that went through to bone on her knuckles. But importantly, she had a fistula or a hole from her cheek right through to her mouth. Unfortunately, even in our own environment, we weren't able to get any meaningful check of her mouth completed, but there was a clear need for us to be proactive in case it was dental pain that was contributing to our problems. So we took part in a comprehensive best interest meeting that involved all of these highly skilled professionals you can see on the screen. And the priority was to exclude a physical cause. And alongside my concerns, her GP was worried that ear pain might be the problem, but we couldn't complete these examinations. We discussed the option of general anaesthetic, but that wasn't without risk, and so the dental team proposed sedation with midazolam, and the special care service would be able to lead and provide this. This is a technique that our clinicians who have had additional training use regularly. However, it's where Natalie's journey would have ended with us if it wasn't for a further partnership that we've developed. So we identified that we had a need for a specific type of clinical holding on a regular basis, particularly to help us with delivery of sedation, because we often give that intranasally or with a spray up the nose first to allow us to put a tube into a vein and give the more reliable sedation. Now, our approach in special care is quite unique, and we began work with the Crisis Prevention Institute, who trained 2 of our dental team as clinical holding trainers, who now deliver that tailored training to our entire team in our working environment. So using those skills, we gave Natalie the midazolam with a rapid spray up her nose, and the learning disability and her care team did a fabulous job while we waited for that to take effect for cannulation. The GP came along and investigated her ears and her skin. Blood tests were taken, her teeth were checked and treated. Now, a huge amount of work by the other teams was necessary after this intervention, but excluding those physical causes was the first step in improving Natalie's health and her quality of life, and we were able to facilitate that in the least restrictive way. And I spoke with our advocate, and Natalie is now doing well, and we were given what I think is one of the greatest accolades from an advocate, that her family members would be proud of what we did that day. Next slide, please. So this is a picture of some of our specialist dental team at an in-house continuing professional development day looking at care under general anaesthetic just last week. And I must finish by saying that this team, including those not in the picture, are absolutely incredible. They go above and beyond every day, and it is an honour to work alongside them. And I'll leave you with this excerpt from a poem, and the observant among you will have recognised the line that I used in my title slide, because it's been quoted in so many forums since it was published in the pandemic. I heard that we are in the same boat, but it's not that. We are in the same storm, but not in the same boat. Now, access to NHS dentistry is probably more challenging than ever before, and so this is the storm that we find ourselves in. However, we're not facing that storm in the same boat or equipped with the same tools, and special care dentistry exists to facilitate access for some of those most vulnerable. It's our job to be their boat in this storm. Final slide, thank you. So thank you very much for the opportunity to present at the annual showcase this evening, and I'll be happy to take any questions at the Q&A session. Thank you for your time.
Jill, thank you so much for that. I think we were all inspired by the experiences and stories that you've shared, and you know, it just kind of brings to life what an insight to the kind of care that the team provides to, as you've described, some of the people who perhaps are particularly vulnerable in our society. So to echo the words, I think, of Danny's family, you're the bee's knees quite clearly. And so thank you. That was really powerful, really insightful. Yes, please do hang around if you can, just in case there are any questions that come up about that. Okay, well, on that really powerful note, we do now have the opportunity to go to our question and answer session. And I know a number of you have been submitting questions as through Slido. So we're going to get straight to them. We've got about 15 minutes to cover them off. So I'll ask the people who are going to answer them, try and keep their answers are short, comprehensive, but short, if that's possible. I don't know whether that's too much of a challenge, but let's try, so we can get through as many questions as possible. I think what you've also been doing is sort of voting up the questions you'd like to see asked, so we can certainly make sure that we cover the ones that are particularly important to you. So the first one, you can see there, what is your strategy for supporting children and young people and getting them quicker access to the support they need? That's just come down slightly, but I think mainly because people are commenting on Jill's fantastic presentation. Can we bring in Anne Rackham, please, to answer the question around children and young people?
Yes, thank you, Krishni. And I think what we can absolutely see as we've come through the pandemic is the real impact this has had on children, not just in our county, but nationally. And we've seen a real increase in children and young people's needs, and we absolutely acknowledge that. What we've also learned is that our county has changed a lot and our community has changed a lot, and we've had to try and work to what our communities now need. So what we've been doing is working with both our commissioners and other partner agencies across Northamptonshire to think about how we look at children's provision in this new age that we now find ourselves in, which is an absolute challenge, but it's brought some really interesting transformation through. And we've seen we've used the opportunity to try some new ways of reaching young people and children and their families. An example of that could be around, we've got our eating disorders service have looked at working with certain categories of eating disorder that we hadn't provided for before, to really drill down into what the issues are for these young people, and that's had some really positive responses. We've also had the co-development of the Daventry Teen Clinic, where teenagers in Daventry can go and get a much more holistic, with a primary care, emotional well-being, mental health support, all in one place. So we've been trying out and transforming some different areas to try and reduce the amount of time that people are waiting. And I think that was asked, the strategy around that has been very much around partnership, because I think actually health can't provide all of the answer for our children and young people, but it's also around co-production with the people who use our services, and that's been really important. And we've just celebrated, in fact, our CYP participation board had its first year, and really signifies the importance of co-production with our young people and their families in trying to look at how do we make sure that we provide for what's needed now, and work with our commissioners about how that's that's commissioned and funded moving forward.
Thank you very much, Anne. Really helpful, and I think, you know, get a comprehensive response there. So a number of other questions. We had Christine from talking about our crisis response unit from earlier, and so there's some really positive feedback there, Christine, thanking you for your presentation. Are you able to just comment on how many individuals you visit on a daily basis? I don't know whether you have that detail to hand, but
Yes.
It'd be interesting to get a sense of that.
So we are still very young as a service, only being operational since June, but the most we've seen in a day is 10, so 10 referrals through from the ambulance service that we've been able to support. But we're doing a piece of work currently with East Midlands Ambulance Service where we've got some cards that we're giving out to put in all the ambulance vehicles, and we're doing a piece of training with EMAS to support them in knowing that the pathway is there, that it is something they can access if there's a mental health need when they respond. But it can vary and fluctuate, so there's no set number that we visit.
Thank you very much, Christine, and clearly you've described their work that's ongoing to raise the profile of the service so it's properly utilised. Yeah, brilliant. Thank you, Christine. Okay, next question that looks like it's got the most votes so far is, could you clarify how you govern by compassion, and how does your compassion culture work versus what you have now? So I'd like to bring in Chris Oakes, who's our Director of HR and OD. Chris?
Yeah, no, thank you, Christine. Yeah, I suppose it's probably better to start the end of the question, what do we have now? Because the Trust has a real commitment to an inclusive culture, and our culture is based around our approach to leadership, which we call distributed leadership, which sees everyone as a leader taking action, so taking the right action, which is part of the compassion in that everybody's looking to do the right things to support people. And we're guided by our leadership behaviours, which are working together, taking responsibility, being authentic and embracing change. And those were developed by feedback we had from all the staff and developed into the leadership behaviours that feed our leadership training. And we get really positive feedback on the culture, and that it does treat staff with compassion, and key part of that's also the freedom to speak up work that we have within the organisation. But there's a real opportunity in how we move forward in the work of Michael West, who describes compassionate leadership as something that allows you to get, create an even better environment for staff. And that's really focused around 4 concepts, which is attending, being present, understanding. So understanding what staff are looking for, what people's issues are, and how you can work to solutions, empathising and helping. And we've again gone back and consulted with all of our staff, and they've given us a lot of feedback, and we're currently developing what we've described as our compassion commitment, which will be a golden thread that will run through all our leadership behaviours. So all our leadership behaviours, if you like, will start to have that sense of how, in all the instances where they're positively delivered, are they delivered with compassion. And we're developing that through engagement with staff, and we've already had a number of conferences, engagements with staff, and we actually have one at the end of this week where we'll continue to build on all this work. And we feel that allows us to start to, I suppose, govern, I'd call it lead with compassion, and to show compassion in how we all work together as colleagues and how we work together to support the staff. So that's how we take that whole element forward, and how we believe that's going to allow what we believe is a compassionate culture, but to develop that far more than we already have, which we think can only be of a huge benefit.
Great, Chris, thank you very much for that comprehensive response. Okay, the next question is, what's NHFT strategy to deal with system financial deficit without impacting on its operations and corporate services, and taking into account the growing and ageing population, including increasing referrals? I think Richard Wheeler, our Director of Finance, is going to respond. Richard, please.
Yeah, thanks, Krishni. Thanks for the question. As an organisation, we are our people. So key for us is implementing the long-term workforce plan. We've done a lot of work to support flexible working and also, as I mentioned earlier, innovation and supporting development of that so that we can deliver services in a different way. The digital agenda is very key for us, and we're doing providing referrals and people are accessing services in a far more digital way now. And the other key aspect is our collaborative working and collaboration with, for example, voluntary sector and other partner organisations, and all of the work we're doing in that vein is the way that we are supporting, mitigating some of the financial risks but we are remaining in a very challenging financial environment. Thank you.
Thank you, Richard. Excellent, thank you. So the next question we have is, what is your policy on freedom to speak up? And this question, I think, can go to David Mayer, who's our Deputy Chief Executive and Managing Director. David.
Well, thanks, Krishni, and thanks for the case studies. They're so inspiring. I'll have a bounce in my step tonight. So timely question with Let Be and other concerns across the NHS. Our approach, as Chris outlined, is very much centred on culture, so that we promote a culture where people feel safe and encouraged to speak up, and that we investigate those concerns properly and that the right support is on hand. The other aspect of our policy relates to protection, so making sure that vulnerable groups, so people new to the trust, student nurses, medical trainees, are free from intimidation to be able to kind of raise concerns. We then have 3 further actions relating to prevention, so making sure that people who have spoken up don't feel discriminated, and that they can continue to do their work and speak up if needed in future. The next policy item relates to taking action. So it's not just enough about listening to people, it's also about putting what we've heard into solid action and then feeding back to people what we've done, which is very important. And then finally, access and shared learning. So we've got a Freedom to Speak Up Guardian in the Trust. We've got a number of champions across the organisation. Angela is the executive lead to the board, along with Melanie, who's one of our non-execs, and I line manage the Freedom to Speak Up Guardian. So in terms of senior leaders within the trust taking it seriously, we hope to kind of make that a reality by virtue of how we manage the function through Freedom to Speak Up. And then finally, it's a gift. So we try and make people feel really valued when they speak up, so that they feel it's something they can ask others to do. They can do it again. They are our champions for good quality, safe care. So it being a gift and thanking people for coming forward is really central to what we do.
Thank you, Dave. Such an important point about receiving it in the spirit in which it's intended to help us improve. I'm going to just push the agenda a little bit by taking one final question that looks like it was voted up. So it's, what effect is the pressure in other local NHS organisations having on NHFT? So we'll perhaps take that as the last question, because I'm conscious of the time, but I'll bring Angela Hillary in, our Chief Executive, for a brief comment on that. Angela.
Thanks, Krishni, thanks for the question. And I think important to say a few things, that the NHS does work very closely together, and I think it's fair to say that we all affect each other with different pressures, different touch points, because access, whether it's through primary care, community care, mental health or acute, it is interlinked, because that is the nature of people and the pathways that they have. But what we do see in NHFT is if people are not able to access in a timely way, then of course their capacity to manage decreases, and that can mean more crisis care for ourselves. It could mean supporting our colleagues with discharge if they're having more and more admissions and needing to clearly get people out back into their own homes. That affects many of our community teams, and clearly we want to work in partnership to support that. This is why the Integrated Care Board and the Integrated Care System is so important, because everybody, people in fact in our population, are dependent upon that integrated care, and that's why the pressures and the planning has to be done together, and that's why we're so committed to our strategy of developing partnership, because we know that we can't influence those pressures and support people without working in partnership too. Thank you.
Thank you, Angela. I will on that note, I will bring the question and answer session to a close, because we're very close to the end of our time, and we do have a little bit more to say before we close the evening completely. There are some outstanding questions, so we'll perhaps talk with Richard about how we make sure we can answer those questions and maybe post the responses alongside the materials that we posted ahead of this meeting. So thank you enormously for taking the opportunity to ask those questions, and I hope you found the responses useful. So it's for me now to just say that thank you very much to Christine and Jill in particular for the case studies they presented. I'm sure you would agree with me in saying they were really fantastic examples of compassion in partnership, which was absolutely amazing to hear. Also, thank you to Angela, Richard, Grant and Jeanette who presented, and of course our governors for their fantastic contributions in putting this event together, alongside non-executive director colleague Judith Seymour, and of course our comms and governance teams. So really important to thank everybody who participated. So we're going to ask you for a little bit of feedback on tonight's event. So please take a moment to share your views and thoughts on Slido using the link or the QR code below on the slide. And there are some questions I think we want to ask, which is how would you rate this event, and what 1 or 2 words describe the impact of this event for you? Are those going to come up? Robert, I don't know. Let me just pause a moment and check. Are those questions coming up?
We can put them up if you'd like to see some of those responses.
Okay, or we can just ask people to respond and we can collect that feedback. Given the time, perhaps we can just collect that. So how would you rate the event is the first question. What 1 or 2 words describe the impact of this event for you? Any other comments that you wish to share about this or future events? And any feedback about content for future events? Would you like to attend future membership events? So those are some of the things we'd really just like to get your thoughts on. So we'll leave the Slido functionality open for you to make any additional comments, and be really grateful for any feedback you can provide. So thank you really everybody for taking part. I actually also would want to say a couple of other things just before we close. I wanted to thank Chris Davison, who is our former lead governor. Chris, I believe, has joined us tonight, so I just wanted to say thank you, because Chris stood down at the end of the last year, and you know, he made a huge contribution to the functioning of our council of governors. So I just wanted to take the opportunity to thank Chris for his contribution, and I also wanted to just recognise that our wonderful Chief Executive Angela Hillary was awarded a CBE in the King's Honours, and that is just something we're very proud of and want to celebrate as well. So thank you everybody for taking the time to join and contributing to this event, and we look forward to seeing you next year. Thank you.
Thanks, Krishni. Thanks, everyone.
Thank you.
Good night, everyone.